Hi guys, Ariana here at the AAFE Training Center. I'm going to walk you through a tox treatment that I've done with my patient. She is actually one of my highest dosed patients. She requires a lot just because she's super tense. She's a nurse, so she, is constantly in stressful situations. And for her, she's probably my highest dosed patient. With that being said, I'm kind of working my way around her frontalis, trying to make sure that I get even spread, but also, am staying high enough that I'm not running the risk of dropping her at all. With that being said, I actually don't mark my patients, as you guys can see. I think that the lines for me personally just kind of get confusing. And so I've just gotten pretty good at not marking up my patients. If you're newer though, I highly suggest marking up. So with that being said, I'm moving on to treating a brow lift for her. So I did frontalis, glabella, brow lift, crows. I don't think we did a jelly eye roll in this treatment, but we oftentimes do. She's normally my patient that I'm also doing a pretty high dose in the masseters, temporalis, platysma. She just has really strong muscles. With time, I've been able to really atrophy those muscles, which has been awesome, but it's taking kind of consistent treatment at a pretty high dose to get there. So with that being said, here I am doing my glabella treatment, and I do go down to bone where that muscle originates. That is just my personal preference and where I get longevity out of my treatment for my patients the most. So yeah, just kind of working my way around. I do a 5-point injection here, and I'm going to pick up that lateral tail and do a treatment in the lateral corrugator. And I'm going to move around and go to the other side and just walk and make sure that I am knowing my anatomy and my depth and everything like that. So here I am doing crows on the other eye, working my way, just temporal fusion line and making sure that I'm doing a really good job of staying superficial. Of course, we don't want to go too deep. We run the risk of eyelid ptosis, brow ptosis, and we really just don't want to do that. So yeah, that's kind of my treatment with this patient. I hope you enjoyed. We teach this in level 2 mainly is when we get down to 1-to-1 reconstitution. Hope you enjoyed.